Good evening, everyone. We have more people in the room than that. Good evening, everyone. That's better. Thank you so much for joining us for such an important conversation this evening on mental health in the workplace and the launch of the long-awaited book, Simple Mental Health by Adam Niemer. Give it up for Adam. This is a great crowd. I'm really impressed for a Monday evening. My name is Sarah Phillips. I'm the Associate Director of Public Policy with the Rosalind Carter Mental Health and Caregiver Program, and I have the honor of welcoming you to the Carter Center and introducing tonight's incredible event. The Carter Center was founded in 1982 by President and Mrs. Carter, in large part to bring people of different cultures, disciplines, and sectors together to solve some of the world's most pressing problems. Tonight's event closely aligns with that mission, and we are so grateful that you're here. Before we begin, I'd like to acknowledge that some of the topics discussed today may be sensitive or triggering for some, so if at any point you feel the need to step out or take a break, please feel free to do so. And of course, if you or someone you know is in crisis or in need of support, you can dial 988, the Suicide and Crisis Lifeline, for free and confidential help 24/7. So, before Adam takes the stage, we're going to spend just a few minutes talking about something that is absolutely critical when it comes to access to mental health care, and that is mental health parity. So just gauging the room here, raise your hand if you've heard of mental health parity. Wow, that's really good. Now, raise them again if you know how employers can help ensure that parity is complied with among their employees. Okay, fewer hands, that's good. We got stuff to talk about, and we're gonna do that today. So mental health parity is one of our key policy priorities in the mental health and caregiver program, among some other areas that you can see here, which we advocate for at the state and federal levels. We focus on access to mental health care and caregiver supports across the lifespan, ranging from primary prevention among youth all the way to older adults with serious mental illness. To advance access to behavioral health care, we bring together partners from various sectors and industries, just like what we're doing here tonight. And we hope that you'll come away from this event ready to learn more and joining us in advocating for parity. So what is parity? It sounds like most folks in the room here are familiar, but we'll set the table just in case. Parity ensures that behavioral health, which is inclusive of care for mental health and substance use disorders, are covered by health insurance at the same level as care for physical health. This means that if someone has insurance, they have coverage for their mental health care. Parity is critical in accessing affordable care, keeping people from having to go out of network for care or pay extremely high copays. The lack of parity in coverage can also reinforce stigma toward having a mental health concern or substance use. By insurance not paying for behavioral health care, it tells us that seeking behavioral health care is something that is out of the norm. But it's not, and everyone who's here knows that. Mental health care is health care, and mental health parity contributes to an overall environment of mental health promotion. So almost all health insurance plans are required to comply with the requirements of federal parity laws. This includes self-insured plans of many larger employers, which are known as ERISA plans. Also, state parity laws apply to fully insured employer-based health plans as well as individual marketplace plans. Compliance with these laws at the state level is enforced by the insurance commissioner here in Georgia, but it's important to note that we're still very much in the infancy of implementing parity laws in the state, and insurers are not necessarily complying with these laws, which makes it critical for employers to know exactly what type of coverage their employees are getting. As I said, parity is essential in access to care. It ensures that people do not face barriers to insurance coverage that can prevent them from getting the behavioral health care they need. In practice, parity violations can look like stricter prior authorization requirements. It might look like higher copays or out-of-pocket costs, harsher limitations on number of visits as compared to physical health care, or even arbitrarily being denied coverage altogether. So what does this mean for employers? Well, because you're here tonight, you're probably familiar with the human case and the business case for ensuring access to care for your employees. Looking at it through the business lens, maintaining a healthier workplace both physically and mentally leads to lower medical costs, increased productivity, lower absenteeism from work, fewer disruptions to operations, and fewer costs associated with hiring temporary staff. It's also important to note that organizations known to prioritize employee health and benefits, and certainly mental health, have higher retention rates and maintain a competitive edge in the job market. And all of this comes from studies performed by the National Governors Association. So that notion is really reaffirmed by a study from the American Psychological Association, where 81% of workers reported that they will be looking for workplaces that support mental health in the future. And like we already mentioned, parity is key to productivity. Depression alone is estimated to cost 200 million lost workdays in the US each year, costing employers millions. And parity is cost effective. Employees not receiving treatment for depression miss an average of 31.4 days per year and lose another 27.9 days due to lost productivity. I would highly recommend searching the Center for Workplace Mental Health's depression calculator, where you can calculate exactly how much untreated depression might be costing your organization. In an example of a business with about 100 employees in the South, an employer will spend an estimated more than $100,000 in a year for depression-related absenteeism alone. These numbers are staggering, and they connect directly to what our amazing speakers are going to be addressing tonight. After our keynote and fireside chat, we'll share more about how employers can partner with the Carter Center and get involved in advancing mental health in the workplace. So please stick around for that so we can talk about insurance some more. Everyone's favorite. We'll make it exciting, I promise. So it is my absolute honor to introduce a friend and a true mental health leader, Adam Niemer, for tonight's keynote address. Adam has had an eclectic 20-year leadership career at Kaiser Permanente on the West Coast, holding various roles in national labor relations and information technology, then CFO and operations executive positions. A few years ago, Adam moved to Atlanta to start his organization, Simple Mental Health, and now works with leaders and organizations across the Americas and Europe to address mental well-being in the workplace differently, more culturally and holistically, and with compassion, facts, respect, and vulnerability. And you will hear that come through in his talk tonight. Tonight, Adam is here to help educate and inspire us as a community to the power of creating cultures of mental well-being in our organizations, and will give us insights into the transformed lives and unleashed performance when we do. He's going to tell us his story and preview his new book about how a CFO turned self-identified evangelist for mental well-being. I'm confident that we'll all leave here tonight inspired about mental well-being, aware of its impact on performance, equipped with a simple roadmap, and motivated to take the next step. But Adam's not the only leader we're hearing from this evening. Following Adam's keynote, we'll have a fireside chat moderated by C. David Moody, founder of C.D. Moody Construction Company, one of the largest African-American-owned construction firms in the country. David has led his company for more than 35 years, delivering over 150 commercial projects valued at more than $300 billion, including landmarks like the Olympic Stadium in Atlanta, the Mercedes-Benz Stadium, and the World of Coca-Cola, among many, many others. Beyond his business success, David is deeply committed to community service through the C.D. Moody Foundation, which has provided more than 8 scholarships and funded endowments at institutions like Morehouse and Howard University. He serves on numerous boards, and the Carter Center is so fortunate to have him as a member of our own board of counselors. So we're thrilled to have David guide this important conversation. But first, without further ado, please give it up for the founder of Simple Mental Health and the author of the new book, Simple Mental Health, Adam Niemer.
You guys can hear me? All right. Hold on, where is... It's hard to see. Yeah. All right. Click, click, click. You guys hear that? Man, that's a sound I heard 20 years ago coming from the heels of my fancy Italian loafers on one of the absolute best days of my career. I was walking down the hallways of Sunnyside Hospital just outside of Portland, Oregon, and the thought crossed my mind, dude, you're the CFO of this place today. What were they thinking? Oh my God, I can't believe I talked them into giving this to me. And the only reason I didn't throw my hands in the air and celebrate having the greatest job in the world, I was miserable. I couldn't breathe. I had clutching pains in my chest that wanted to explode. I had anger I couldn't put my fingers on. In effect, I had a 18-year anxiety attack layered on top of severe depression, and I had no clue. I just thought that how I felt was what life was supposed to feel like, strutting down that hospital corridor that afternoon, I thought I was going further and further into my dream career, but I was just going deeper and deeper into a really dark and lonely place. It impacted my ability to lead, to be led, to be a husband, a father, a friend. It impacted my ability to be the person I wanted to be. By all outward appearances, I lived this charmed life, but on the inside, I was always so sad and so scared, and I couldn't control my emotions, and I didn't know why. Then about, almost 8 years ago now, something just really special happened, something that shifted my life in the most profound way. A colleague at work, a national executive at Kaiser, this fella, here he is with his wife Marcy, David Lake, a national leader at Kaiser. He asked me to join him in his office one morning, and when I got there, he asked me how I was feeling. And when, I had recently found my mom after she had passed away, and having learned the signs of someone who may be struggling with their mental well-being, David had recognized a bunch of behaviors in me that really worried him, and he wanted to help. Right, so he asked me if I'm doing okay, and he says, "So, sir, you seen a therapist?" I'm like, "No, man, I don't need to see a therapist. I'm doing great." He goes, "Okay, I get that, but Adam, do you know the signs to look for in yourself in case you might need to get some help down the road?" As I say no, he pulls out of his pocket the business card of Kaiser's Employee Assistance Program, slides it across the desk, and he's like, why don't you give EAP a call? It can't hurt. You've had these string of traumatic experiences in your life, and you should at least know the signs to look for in yourself in case you might need to get some help down the road, right? That 5-minute conversation, it helped change my life. It set me out on a journey of recovery that's made the moments since then so much more full of love and joy and happiness. In just a 5-minute conversation, this colleague at work helped, put me on this whole new path. I wasn't surrounded by that click, 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 click all the time. David helped launch me on a path of self-discovery and healing, a path of hope and optimism, a path of spiritual awakening and fulfillment. And I realized that I wasn't on it alone. The path that David set me down by calling the EAP hotline, by going to therapy, by talking about my feelings with the people in my life, I found that I had a ton of folk all around me who just wanted to be there and help and love me and try to help me get better. And I also learned that by being open and honest about what was going on with my mental well-being on a day-to-day basis with colleagues at work, whether they were senior leaders or staff members, and genuinely caring and worrying about all of their emotional needs and mental well-being too, that, not only my life and the lives of a lot of my teammates changed, but our business performance changed, right? A high-performing team started delivering on a level that was completely different than before. And what I hope you hear from tonight, what I hope you take away from my book is, it's time for all of us to break through the myths and stigmas of mental illness that have informed traditional leadership practices, right? It's time for all of us to have mental health literacy in our professional toolboxes. We all have a physical health literacy in our toolboxes, right? If someone was choking at a lunch meeting, we'd all know how to help them. If someone was having an anxiety attack at that very same lunch meeting, you wouldn't know how to help them, let alone even know if they were having a struggle to begin with. The bottom line is that learning the signs and symptoms that someone may be struggling with their mental well-being, learning how to approach them and engage them in a safe, thoughtful, caring, non-judgmental manner while providing hope that recovery is possible, knowing how to guide folk to services in the community and provided by your organizations where they can get help, knowing how to normalize the topic of mental health in your teams and organizations. These skills are just as relevant for a leader as knowing how to put a budget together, put a marketing plan together, lead a team meeting, recruit folk. I mean, just look at the data. Moderate depression alone has been shown to drop average productivity by 35%, right? So that's 2 lost days of work productivity each week when someone struggles with moderate depression, right? So minor depression is like 20%, severe 45 plus. Now, on the other hand, Oxford University, their MBA program a few years ago out over in the UK, found that folks who are happy have 13% higher productivity than average, right? Now, and it impacts just like, it's about just showing, it's hard to hit the simple stuff when you're struggling with your mental health. The Gallup group found a few years ago that Americans who struggle with their mental well-being have 5 times more unplanned absences each year, right? And they quit their jobs. 50% of millennials, 75% of Gen Zers have left a job in part due to mental health reasons, right? And as Sarah mentioned earlier, 81% of Americans share that how a future employer will support their mental well-being will be a significant factor for them in choosing their next job, right? So 81% of the people that we're all looking to recruit, grow, retain, they expect us to know it with this information already, and they've proven that they'll leave us if they don't. And you really can't blame them because, without knowing it, because we weren't really educated on it. The American leaders really, we've abdicated one of the fundamental accountabilities of leadership to create a safe and injury-free workplace, right? So SHRM, the Society for Human Resource Management, they're the premier HR industry association. Are there SHRM members here? There must be a SHRM members here, all right. Last year in the annual SHRM workplace study across America, found that more than half of Americans feel emotionally drained, burned out, and beat up from their work. And more than 35% of Americans say that their workplace has a negative impact on their mental health, right? All right, so to be crystal clear, that means that on any given day, right, more than 1/3 of us may be leaving work in a more clinically ill manner than when we walked in the door, right? The workplace, it's actually clinically hurting us, so much so that the state of the workplace well-being in America is so dire that a couple years ago, the then Surgeon General Vivek Murthy identified workplace well-being as one of the top population health priorities in the United States. I mean, let that sink in for a second. One of the most powerful levers we as a people have to pull to improve the overall health of the nation. On the website today, I looked last week, it was still there, unless something has changed recently. We have a new Surgeon General, but the data's still there. You don't see homelessness, obesity, diabetes, opioids, but workplace well-being. How we experience the environment and cultures of our workplace is now one of the top 12 population health risks in our country, right? It's the thing that we can do to make us the most healthy. And it makes sense when you think about the prevalence data. So here we go. So here's the official prevalence stat. Every year, more than 1 out of 4 Americans experience what a behavioral health clinician would diagnose in a medical record as a mental illness. Less than half of us get help, and the average time period from the onset of symptoms to getting help is like 11 years. Can you imagine noticing the signs of breast cancer or skin cancer but waiting 11 years to see the doctor? Right? So it's 25% of all the people in any room you walk into all year. It's 25% of all of you walking into any room you walk into each year. So let's paint a finer point on that. So do me a favor, help me out. If your birthday is in, I don't know, June, July, or August, stand up for a second. June, July, summertime birthdays, stand up. I'm so sorry, you didn't come here to exercise. This looks, okay, so now, so stay standing for a second. All right, so now everyone look around the room for a second. Yeah? This is what 25% of this room looks like this year. All right, thanks, guys. You can, but we don't know if, we don't know if that's the right 25%. So, blue eye folk. Everyone who has blue eyes, stand up. This is gonna be hard for summertime blue eye birthdays. All right, blue eyes. Who's got blue eyes? Oh, see, okay. So now, if you're over 6 foot, stand up too. Or this is blue eyes too. We need more people. There's blue eyes standing up and more than 6 foot, and maybe in the red in the back. Maybe you guys in the way back there. Yeah. Let's get you guys up. You guys got nailed. Okay, that's perfect. Okay, so now this is what 25% of the room could look like too, right? The fact of the matter is I have the foggiest idea what 25% of the room it's going to be this year. I just know with, you guys can sit down, thanks. I just know with scientific precision that it's going to be some 25% of the room this year. And if you don't do something about it, 25% the next year and the next and the next and the next. So mental illness, it's real. It's all around us. It can be paralyzing. It can hurt like hell. It's stunting the performance of all of our teams and organizations. But I swear, as a recovering CFO, I just see dollar signs all over the place here. Because here's the really good thing is that, we can get better. Recovery from a mental health condition is possible. Conventional therapies more often than not work, and treatment modalities are getting better and better every single day. The fact of the matter is that the recovery from a mental health condition, it's not just possible, but it's probable. And it's not just probable, but it's expected, especially with early intervention. And so you got to wonder, what the heck's going on here? How could so many of us be experiencing this clinically diagnosable and treatable illness, but so few of us get help, right? But that's been studied too. And you will be unsurprised to find out that 80% of people who don't get help for a mental health condition say that the number one reason they don't get help is stigma, right? They're afraid what everyone else is going to think. Can you imagine if a quarter of us got diabetes every year, but half of us didn't get help because we were embarrassed, right? It's insidious. It's this isolation cycle around mental illness that has evolved over time in our society, where the myths of mental illness, like depression isn't real, those fuel the stigmas, like people with depression are just weak. And those stigmas drive feelings of shame. Oh my God, I'm a depressed person. I must be weak. What's wrong with me? So what do? You stay silent. And there's this self-perpetuating cycle that that's literally ripping us apart from each other, right? But in here, it's also, in there is also an elegant solution. Because as we share our stories with each other and educate ourselves, the myths get busted, the stigma fades away, the shame kind of evaporates, and then people start telling their stories and more people start getting better, right? So there's an elegant solution in here. And so, in that spirit, I'll take you back to that 5-minute conversation in David's office now, almost 8 years ago. As I walked in his office that day, I had no idea the severity of the illness I'd had for the last 18 years, let alone that I struggled with my mental health at all. And which is ironic given where my story really begins. When I was a younger guy, 29, and getting groomed to run my family business, I found my dad after he died of suicide. And I didn't get anywhere near enough help that I needed. My best friend, my business partner, the guy I always wanted to be like, calm, cool, collected. Morton Emer was the last guy anybody thought might be struggling with their mental health. And what happened at this crossroads of my life where I needed it the most and it would have prevented so much pain down the road, I only had a few therapy sessions and I just went off running into the world, right? Finding my dad's suicide was like this shadow that was always with me, right behind me, just ready to lurk out and pop out and haunt me if I stopped thinking about anything else. So I ran really damn fast. I got an MBA, I got married, grew a successful career, CFO of a hospital, CFO of a multi-billion-dollar healthcare system. I ran the operations of a $4 billion health plan, for a guy who only got into business so I could hang out with my dad every day. I was doing okay as an accidental healthcare executive, right? Or at least I thought I was, because at times, without knowing it, I was a monster to everybody around me, right? My colleagues at work, my kids, my friends, my now ex-wife. I raised my voice. I interrupted people when they spoke. I could be relentless, arrogant, short-tempered, defensive, impatient, dismissive. I could be a real son of a bitch to everyone. But what I really was just the son of a guy who had taken his own life. I was the son who lost his icon. I was the son who didn't know where to look to deal with this pain, so I pushed it down, right? And I had no idea I was using all of my strength and resilience as a person to keep it hidden from everyone around me, even from myself. But that dude, David Lake, Lake had mental health literacy. He recognized the signs and he knew what to do. By the way, here's what actually happened. And this, I cannot believe the universe works like this sometimes. But so David Lake, he asked me to join him in his office on a Monday The day before on Sunday, he's sitting in his church in a mental health first aid class as they're going through so he's in his church, going through a mental health first aid class on Sunday. They're going through the signs and symptoms that someone could be struggling with their mental health, and he's like, Adam. Oh man, Adam's in a lot of trouble. Love this. Next day, the next part of the class, they teach him how to approach somebody in a safe, thoughtful, caring, non-judgmental manner, is when they gave me the business card to the employee assistance program. Is where he came up with that idea. So, a senior leader at an $80+ billion company went to his church one day, became mental health literate, and the next day in a 5-minute conversation, helped get me on the road and on the right path where I could take the steps to get better. And where is the next day I saw the EAP counselor, and that's where the real hard work of healing began, right? Starting taking antidepressants, going to therapy, specialized trauma therapy, and all that helped a ton, but I still was moving through life feeling like I was running upstairs breathing through a straw, right? And then one night, I accidentally went to my very first slow vinyasa hot yoga class. Next day, for the first time in years, I took a deep breath, right? And even though I still have good and bad days over time, eventually I came out the other end. I came out stronger than I ever thought I could be, for the very first time in my life, true self-love, respect, self-trust, self-confidence. And I came out forged with this knowledge that there's not one thing the universe or serendipity or genetics can throw my way that I can't overcome. And while I was on that journey of recovery and getting educated on the facts, I started thinking about leadership differently. At the time I had maybe, 400 folk on our teams in the Northwest, which meant that I was gonna have 80 of my colleagues, my brothers and sisters, my friends, right? These people I work with every day. 80 of my folks are gonna be in just as much pain as I'm in, and most of us were gonna be struggling in silence like I was. I started thinking, oh my gosh, what if we were gonna have 80 people with heart disease, cancer, diabetes, whatever? We'd have a crisis on our hands. And so we volunteered to pilot a workplace mental health literacy program for Kaiser nationwide. So we did this in the Northwest. We took all 400 folk out of work over the course of 2 weeks in 4-hour increments, executives, staff, supervisors, everybody together. We all learned how to notice the signs and symptoms, to approach thoughtfully and guide to services. And what happened, and what still surprises me, is that over the next couple years, as we kept training everybody, and as I kept being honest with what was going on day to day, I'd be like, guys, I'm having an anxiety attack. I got to run out of here. I'll be back in an hour, right? And as I was talking like that created the space for everyone else to start sharing their stories, right? 2 years later, we're the highest employee engagement stats nationwide for Kaiser's health plan. We're the happiest employees of 25,000 people across the country in our little teams in Portland, Oregon. It's amazing. We also, 2 years later, on almost every single health plan operations key performance indicator, we were #1 in the country for Kaiser. So we were the highest performing health plan nationwide for Kaiser. We also, 2 years later, were the highest performing Medicare health plan in the Pacific Northwest, and within the top 6%, I shouldn't do that while I'm talking, should I? Top 6% nationwide. All I wanted to do was get people not to hurt. But what we ended up doing was unleashing all of that productivity and performance that's stuck up there that we were talking about earlier, right? you know, over a 20-year career at a organization that, you know, really invested heavily in facilitative and psychological safe leadership training for their teams, going through a mental health literacy training program with my teams was the single best team development and performance growth opportunity I ever participated in, right? And it was so unbelievably also very simple, right? You know, in effect, all we did, for the love of the universe, all we did is just learn to have 5-minute conversations like David had with me. That was it. That was it. But before all that started, about a year before this, so I told you earlier, I saw David, he sends me to the EAP counselor. Then I took about 6 weeks off of work. And when I came back to work, everybody was like, so dude, where have you been? And I wasn't sure what to do, right? And you know, you don't like run a health plan and just disappear for 6 weeks when no one says nothing, right? So maybe about 3.5 months after I came back to work, we had an all-hands meeting in the Northwest. We had about, you know, a couple hundred people in the room like this, and people, what do we call them? Video link on the walls and stuff, people who worked from home then. And, you know, I had the head of mental health for Kaiser help me. He interviewed me, and, you know, I just shared with them what was going on in my life. Told them about finding my dad's suicide, about all those years of illness, about how it was through the love and attention and courage of David that I was able to really recognize how much I was struggling and get on that path to healing. You know, a few days later, I went for a walk with this young guy on our team, this fella named Cameron, this young, earnest, high-performing 20-something kid we had recruited from Colorado. And we're going for a walk, and he starts thanking me. And I'm like, why are you thanking me? He says, when I was a kid, when I was in grade school, I attempted suicide. And I went to therapy through middle school and high school, and you know, it just didn't seem to work. And I know I don't want to die, but I just always thought that my life was going to be sad. And then I heard you, my boss's 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 boss, share that you were going through the same thing, and that even though it wasn't working yet, you were going to stick with therapy for a while because you had confidence that it would work. You're like, I'm just thanking you because it inspired me to try therapy again. And he had made an appointment for a couple weeks down the road. And you know, this kid, Cameron and I, we stay in touch to this day. And I had a chance to, when was the last time we chatted? In September, middle of September we chatted. And I am here to report that 8 years later, Cameron's thriving. He's thriving, he's happy. He's surrounded by a great group of friends in Portland. He just started a job in October that he's really, really excited about. And if Cameron were here tonight, if David Lake were here tonight, you know, what they would tell you is, if you want to take care of your business and your teams, you got to take care of your people. And if you want to take care of your career, you have to take care of yourself. And there's just no better way of doing that, and starting with the foundation of mental health literacy and normalizing the topic of mental health on your teams throughout Georgia. And what happens is when you do, you end up with people like me running around talking about you the way I talk about this Lake fella, right? As one of the kindest, most thoughtful, authentic, empathetic, yet performance-driven leader I ever worked with. And I cannot wait to see what my new home of Atlanta and Georgia looks like when you do. Listen, thank you so much. It has been just an honor to be able to spend some time with you. And Mr. Moody, if you could come on up. Thank you. Thanks, guys. Yeah, hop on up.
Okay. That was excellent. Proud of you.
Thank you.
All right. How's everybody doing? Let's give Adam a hand.
Thank you.
I'm sitting here kind of laughing. I came to Morehouse in 1974. In my very first presidential election, I voted for Jimmy Carter. So I'm sitting here going, wow.
Isn't it amazing?
Yeah, no, it really is. I mean, I think back when I came to Atlanta, Atlanta had just reached 1 million people. 285 was empty. Serious, at night, 285, we used to drag race on 285 because it was empty like that. So to be here with you, Adam and I met at Goodwill. We were doing a session on mental health for Goodwill. And we just connected. It's funny, when you go through certain things in life, you tend to just connect with the people who kind of been there. So I'm gonna start off with my questions for you. Let me get my notes so I stay online. First of all, after doing this, I know for me, when I speak on these topics of mental health, how you feeling? Takes a lot of energy. How you feeling right now?
Both drained and energized at the same time. I feel better.
Right.
That's how I ended up doing this when I was working at Kaiser, is I found that if I gave talks to different groups, it made me feel better.
It's interesting you say that because I know whenever I do that, I'm drained, but I feel better. Because I know that one person's being helped by just sharing our story. Because I'm sure you probably had the same thing happen to you. People go, man, I never would have thought you dealing with what you've dealt with.
Yeah.
Because one thing people are really good with who deal with mental health type things, like I deal with anxiety. I had a complete nervous breakdown in 1992. And from a childhood trauma that I thought I buried. You can go to moodyspeaks.com to read about it. I don't like to say what it is because I don't want to trigger anybody this evening, but go to moodyspeaks.com and you understand the childhood trauma I went through.
There's a QR code for it right there, big guy.
And I thought I had buried it. And that's the barcode for the website. I thought I had buried it. And that's the one thing we do really well, people who deal with this, we make it look like we're okay. And that's probably the worst thing sometimes, because when you make things look like you're okay, you tend not to go get help because everybody says, man, you're great, you're fine. But it's those private moments. So when you talk about your comments in your book that therapy was the best executive coaching you ever got, what did you mean?
I knew that I wanted to be a facilitative leader. And I knew that I wanted to be a nice guy. I'm a happy person. I didn't want to be an SOB, right? I didn't want to be that. You can choose what sort of leader you are. And every year, not every year, but towards the last handful of years before I recognized how sick I was, I realized that I wrote in my individual development plan the last few years how proud I was to becoming a facilitative, psychologically safe leader, but I didn't like how people experienced me when I was having a bad day.
Right.
And all of these leaders I worked for, I worked in healthcare, so my leaders were nurses, physicians, and they're all giving me Harvard Business Review books. Like, go read this book. I'm like, I didn't need another Harvard, I needed therapy, right?
Right.
And what I found was that I spent years trying to figure out why is it that if all I want to be is a facilitative leader, why am I such a pain sometimes, right? And I couldn't figure it out, and it was going to therapy that figured it out for me. I finally was able to I could be the leader I wanted to be because I could control my emotions.
So how did writing the book So when you wrote the book, what did you find, was it hard for you to write the book, to revisit some of this stuff and put it on paper?
It's interesting. Yeah, it was hard. I hadn't anticipated it, right? I'm an idiot. I just started writing, right? And I just didn't anticipate, oh, I got to revisit these things again. And like, because you got to revisit them in detail, right? And I'm like, I'm like calling my sisters, hey, is this what happened? Is this what happened? And I hadn't planned for it to be hard.
Right.
Or emotional. And I wouldn't say that it was hard, but going through it and writing it was completely emotional. And it was like going through therapy again and processing it again. So when I was done, I felt better.
Did you ever have any moments when you were writing, because I know when I wrote my book, there were times when I would write and get on a subject and topic that I would freeze. And then once I got through it, I was like, oh, wow. I mean, I didn't realize that certain things were so much harder on me than I really realized until I started actually putting it in writing. Did you have moments where you thought something you wrote about was going to be easy or a piece of cake, but once you touched it, it opened up a whole bunch of other stuff you didn't know it would open?
It was hard to write about my mom. You know, I think through I guess now it's been an 8-year journey of getting better, right? And so I processed my dad. I got him down, I guess, you know what I'm saying. But mom, I hadn't really come back to finding my love for her. You know, she was this amazing mom as a young guy, and she had her own struggles and her demons, and she wasn't the mom as an adult that she was as a child.
Right.
And so it was, you know, it was really a lovely experience to like I am now, December 8th, 2025, in much more feeling like a loving son for my mom.
Right.
Than I was before. Yeah.
Good.
It was neat.
So let me ask you this, something you didn't talk about tonight, but is in your book, the connection between your physical and mental health. Want to touch on that a little bit? Caught you drinking, huh?
Yeah.
I'm good at that.
So yeah. So, you know, the Surgeon General, you know, Vivek Murthy, you know, his other quote from a couple years ago, people who struggle with loneliness, right? A cause and effect of depression. Loneliness impacts your mortality as if you smoke up to 15 cigarettes a day. Right?
Right.
It's just unbelievable. And for me, I struggle with Crohn's disease, you know, an intestinal thing that I've had since I was in high school. And so, you know, you talk about the connection between your mental health and your physical health and all that. Before my father died, I had a little bit of Crohn's in high school, and then I had nothing for a few years, and I forgot I had it. And then he died. I then had 11 flares and 3 surgeries in 11 years. I had a hospitalization a year for 11 years. And then as soon as I started getting therapy and getting better, zilcho. Not one flare. It is. I don't know. Have you experienced that?
Yeah, I'm a firm believer. Our mental health and performance go hand in hand.
Yeah.
I mean, I can when I'm clicking.
How did you see that for yourself? Like, tell them your story.
Yeah. Well, you know, it's interesting. You know, I was born 1956, South Side of Chicago. So, you know, I grew up in the '60s. So I also grew up in a time where I'm watching as a kid, you know, 8, 9, 10, all the way to 13. I'm watching people who look like me getting hung, killed, water dogs, you know, just to try and vote and have rights. So that's automatically putting something in my mind too. And then unfortunately, you know, I had a horrible childhood trauma that And I always tell this, and I want to tell this, my mother had an inkling something was going on. And so as parents, I tell this to parents, you got to be careful how we say things to children. My mother said it in a loving way, but the way she said it, she said, don't let anyone touch you. Well, he'd already touched me. So now I'm thinking it's my fault. Yeah. So I immediately now go radio silent. But also in the 60s on the south side of Chicago, ain't nowhere in the world I was going to tell what happened. You know, that just would have been horrible. But I'm one of the fortunate ones because I was about 9 or 10 when it happened. And at 14, my dad got a job opportunity at the University of Michigan as a professor. So when we moved there, I got a chance to be completely removed from the environment. I felt like now it's buried. No one to ever know, the whole 9 yards. So, you know, life goes on, come down here to Morehouse, graduate, come down here and play football. And, you know, then I go to Howard University, get my degree in architecture, start working as an architect for Bechtel. And I get married to my wife, who I met. I had to tell y'all this real quick. My wife and I met 1973. A buddy of mine took me by our house, and I'm going into our senior year in high school. We're 30 days apart. And a buddy took me by her place. And I said, you know, I'm a quarterback of my high school team. She goes to the high school. I said, I'm number 12 in your program, but number 1 in your heart. And she blew me off. I went, oh man, she's stuck up. You know, I'm like, I don't want to have nothing to do with her. So fast forward 2 years go by, and I come home summer 1975 to Ann Arbor, Michigan. And one of my college teammates is working in Detroit, which is 40 miles from Ann Arbor. So I said, hey, Kenny, I'm going to get us some dates for the weekend. I'll come get you and we'll stay at my parents' house. So I'm trying to talk to one of my wife's girlfriends. So I said, look, get somebody for Kenny. Well, she gets my wife. You know, I remember her being stuck up. So she was pretty, but I was like, she's stuck up. So, and she ignored me being number 12 in the program, number 1 in your heart, and she didn't fall, you know. So I'm like, she don't get it. So she didn't understand who I was. So we decided to go out, and I look and go, wait a minute, you know, we kind of interact. I'm like, I might have gave Kenny too good a deal. So this is before Google. You had to think, you know. So I'm like, okay, I got to keep them from kissing, because if they kiss, then all bets are off. I sat between them. I did all kind of stuff the whole night. Now, we were supposed to go out the next day. And I told Kenny that morning, I said, Kenny, man, you know how dads are. He said, man, I didn't do my chores like I'm supposed to. I got to take you back to Detroit. I took him back to Detroit, came back to Ann Arbor, called my wife, said, I'm so sorry. Kenny had to go back to Detroit. I'll take you out tonight. Now, here's the kicker. 7 years later, 1982, I hadn't talked to Kenny in about 4 years. Kenny's flying through Detroit because I went back home to work as an architect for Bechtel in the Ann Arbor office, and my wife and I decided we're getting married. So Kenny happens to call, and again, this before cell phones and all that. You know, he had a landline. Somehow he found me in the phone book. And I go, Kenny, how you doing? He said, you know, I'm doing pretty good. What you doing? I said, man, you ain't going to believe this. And he said, what? I said, man, I'm getting married. He said, who you marrying? I said, remember that girl, Carla? He went, yeah. I said, that's who. Kenny hung up. I ain't talked to Kenny since 1982. But I tell you that story because God had a plan for me that I didn't realize, okay? So we got married, and then in 1991, I mean, my business was 3 years old in 1991. Man, I was the first person of color to win the Small Business Person of the Year from the Atlanta Chamber of Commerce. I get an award at the White House as a contract. I mean, I'm booming. I'm like, man, my life, man, is kicking. You hear me? Right. Well, my wife gets a call from somebody that she knew in her family, that said someone had been sexually abused by someone that she knew. And I blurted it out. It happened to me. So I was triggered, wasn't prepared, thought everything was okay. Well, about a about a month or two later, I started going, man, I don't feel like I'm in control. I can remember it vividly. I just kept saying to myself, man, I don't feel like I'm in control anymore. Then all of a sudden I had this incredible panic attack driving. And I called 911, and I still tease my wife about this. First person I called was her. Cell phones we had in, 92. Of course, she don't answer. So I'm like, man, I'm gonna die and don't even get to tell her bye. So, man, the ambulance come, the fire trucks. I'm on the side of Rock Ridge Road in Pine Lake. Never forget it. Man, they got me hooked up. They said, sir, we can't find nothing wrong with you. So I go to my doctor. I'm not thinking what happened to me as a child could be affecting me 26 years later. Come on. I played football. I'm a fraternity. Ain't no way in the world I could be bothering me. So my doctor just went, man, you just probably under stress, young family, business, keep these pills, you'll be fine. And I still laugh about being on the side of the road now because I was more concerned about who saw me. Kind of like, when you walk in and you trip, you try to play it off, see who saw you. I wasn't worried about I was dying maybe or whatever. I was more worried about who saw me. And that's part of the problem with mental health. We worry too much about who's gonna know, who's gonna be whatever. So anyway, I fast forward, I just kind of keep powering through, and then I had this complete nervous breakdown in St. Simon's. And Carla was home in Stone Mountain, and I had another bad panic attack.
You're at home or you're at work?
I'm at St. Simon's Island at a meeting.
At a meeting
at
for
a
work?
Dinner.
Like with colleagues?
Yes, at a dinner.
Then what happened?
To this day, this is why I don't wear a tie, because I had a tie on. So I started taking my tie off. I'm like, man, I can't breathe. And my buddy who wanted to lead the dinner anyway took me to the, and he's a Morehouse man, Ken Matlock. And he took me to the emergency room in St. Simon's, and they hooked me. They said, sir, we can't find nothing. And I get back to the hotel room. Now I'm having uncontrollable muscle tremors. I can't stop crying. I'm having a full-blown nervous breakdown, which I thought that was actually fake. I didn't think people really had nervous breakdown. I thought that was just a term. And here I am having it. I'm like, oh, damn, this is real. That was the longest.
It's like a sledgehammer.
Yeah, it was the longest 5-hour drive home the next morning because I had to leave the retreat and everything. And I remember getting home basically passing out. And I still didn't put two and two together. So the only kind of therapy I did was just understand panic attacks. So I just powered through for another 20-some years. And then finally in 2021, I felt myself having a breakdown again, except this time my wife went to psychologytoday.com, found me a trauma therapist, and then I did cognitive behavioral therapy for a couple of years. And then I hiked Mount Kilimanjaro in 2023 to test myself. And now I'm doing EMDR, which
explain what that is to folks.
It's an eye movement therapy to help reprogram your brain how you think. Because one of the things about when you suppress trauma like that or deal with anxiety and stuff, your mind starts telling you certain things and you start thinking the worst and all these kind of things. Even though to the average person I look like I'm fine, I'm wrestling with negative thoughts about, man, the world's going to end, the floor is going to crash. So doing this EMDR has been incredible because it's like freeing myself. But one of the reasons I speak up, because I don't want anyone else to suffer in silence like I did. I was so ashamed and embarrassed. I'm like, man, you have a breakdown, you're weak. If you go to therapy, you're weak.
Yeah. And
therapy is the best thing I ever did. So one of the things I try and do in my workplace is that I share my story. And I pay attention to my folks, and I don't get into their personal life. I went, you okay? And many of my folks have actually gone to my therapist. I said, look, call this person. He is incredible. You'll be happy. And I try to make therapy comfortable for people.
That's amazing. The construction industry is in crisis.
Yeah, construction industry is one of the leading industries for suicide.
Second, I heard that there's 5 times more suicide deaths each year amongst construction workers than on-site deaths.
Oh, yeah. And I tell you what, I think entrepreneurship should be number one. Anybody who's made payroll, y'all know what I'm talking about. Staying up, like when everybody else sleep, you pacing the floor, wondering. And one of the other things I learned on this journey where I'm finally getting free, because I was always in survivor mode. Now, the one good thing, my wife, and I always tell her, she's the reason I'm even sitting here today, because I kept going because of her and my children. But I never wanted to take my life, but I was okay if I just went and lived in the woods somewhere for the rest of my life and just don't deal with it. And then trying to be an entrepreneur on top of it, making payroll and just all, and it only takes one bad job and you're out of business. To make it 38 years, I was 31 years old when I started my business. And this upcoming May, I'm gonna be 70 years old.
Wow.
Yeah. So, but one of the things I realized, Adam, God had a plan for, he took me on this journey to do what I'm doing now. Because I really think if I had got the proper therapy at 36, I never would have shared this story.
That's right.
I would have kept it quiet. I would have buried it. Nobody ever would have known.
What was it like coming out in your community?
I was surprised, all the support, and you would be stunned, especially men. How many men go, thank you? I mean, I had a guy today, I was telling my wife, me and him been talking for 5 years. And I just called, he had a heart attack and he has congestive heart failure. And I called to check on him. He lives out of town. And we're about to hang up. He said, I just want to tell you something. I said, what? He said, I ain't never told a soul. What happened to you happened to me. He said, thank you. He hung up the phone. But the ones that get me are the people that tell me I saved their life.
Yeah. Is that special?
Oh man, it shakes me up, but it gives me energy to think, people really listen to what you're saying, and you give them confidence to say, I don't need to kill myself today.
Yeah, that's amazing.
Those are the ones that really touch.
That's really.
And I'm glad I met you.
We were lucky. Ron introduced us. He's here. Do you see him right there?
And I had a goodwill meeting in the morning.
Forehead.
We met during the interview for goodwill. And that's what I mean. When you have similar journeys, it could be different reasons, but mental health is something that you just connect. And one of the things I want to make sure we stop making mental health a negative, bad word. See, we always think mental health means you're crazy. That's what I was told growing up.
We were all told that.
Yeah, man,
there's something wrong with you.
Yeah, something wrong. You need mental health. But I'm a firm, when my mental health is clicking, my performance is off the charts.
That's right.
When I was hiking Mount Kilimanjaro, the reason I did that, I wanted to test high altitude is like having panic attacks. The very first night in the tent, I'm at 9,000 feet, and I had a panic attack in the tent. I'm like, man, I ain't got to do this. I'm taking my butt back down this mountain. But then I went, man, you're going to see these 8 days through. And, so I did Mount Kilimanjaro for everybody who's ever wondered, could they do it and get through stuff and enjoy life. And I also want to make people understand, even though we've been through some of this stuff, you can still have an incredible life. And I have so much fun. Just like meeting you and getting to know you, I never would have thought you were a jerk. I'm just being honest. If somebody was to tell me to describe you the way you said you were, I never would have those words. So that shows you what therapy does.
Yeah.
Now, I never was difficult because I got a wife who will smack me upside the head. In fact, when you get over 65, when you go to the doctor, they ask you certain questions. So I developed tinnitus and this ringing in my ear recently. So my wife and I, we're at that age now, we go to the doctor together so we can track what they're saying, because we both 69. So they were asking these questions, and the nurse went, "Sir, is there anyone at home who's yelling or being mean?" And I'm going, and I started blinking real fast, for this. And the nurse didn't know if I was serious or what. And then my wife kind of hit me in the shoulder. I said, see? So, but my wife is the reason I made it because, and I always tell this to folks,
You need people.
she ran to me and not from me when I had my breakdown. And that was the most incredible thing, because she had just finished nursing school. She was an RN. She had been out a couple of years, and she did hospice for 20-some years. She didn't know what was happening either. She was scared. She never let me see how scared she was. But she ran to me. She never left my side. She said, we'll get through this. She hugged me when I need to be hugged, loved me, and she kicked me in my butt when I need to be kicked in the butt, said, you gonna do this. And I was doing these, we won the Olympic Stadium during this time period. I would go to these presentations with my joint venture partners, and they didn't realize, man, I was falling apart inside. But God gave me that strength, say, hey man, you can get through this. And when we won that, you know, my whole career changed after that. But people don't realize I was messed up. I should have been in a hospital. How I made it, it's nothing but God and my wife. It just no ifs and buts about it.
It's like you're wearing a mask.
Yeah, I mean, yeah, seriously.
Wow.
I was so messed up. I was starting to have those disassociation moments where I didn't even think I was in the room. I mean, it was getting weird. I mean, and that's why I tell folks, the mind is so fragile. And it affects your physical health, you know, all that. So don't play with it.
Yeah.
There's nothing to play with. But you can overcome it and you can be awesome.
Yeah. You can get better.
Yeah.
You can get better.
Like I said, who would ever thought you was a jerk? I mean, that just tripping me out. You know, I keep looking at your sisters like, was he really a jerk? I mean, he's such a nice guy now.
Ask my ex-wife. She's over there.
Oh, okay. But you must be doing something right because she's here.
That's right.
That's what I'm talking about. And, you know.
I made up for it.
Yeah, but people don't realize when you're going through what you're going through and don't understand it, that's the scary part.
Yeah.
I'm like, what are these panic attacks? What the heck? You know, I'm like, man, I did all kind of stuff in life and I'm having panic attacks?
And it's like you're living like that for years, just thinking that's what life is like. Like, this is normal. And
right.
then when it goes away, it's like, whoa.
And then also, you're trying to prevent having them. Mm-hmm. You know, when your anxiety, you know, and it's funny, that was 1992, what's that, 33 years now? I carry a Xanax in my pocket. It's my safety valve. I hardly ever use them, but that's my safety. I mean, I'll freak out every now and then if I leave my pill case. I'll leave everything. I'll leave my wallet, but I make sure it's because it's my safety valve. And when I flew to
Totally.
Tanzania, because I was, went by myself, and my wife flew over and met me, and then we spent 14 days living in the bush. We lived in tree houses and tents, chasing animals, and she had only flown twice by herself. Now, she's always flown with me.
Right.
So she was tripping because I got to fly, and it ain't nonstop. She had to switch flights. And so I had just came down the mountain when she was coming to the hotel that night. I had just driven back. We saw each other and just fell out in each other's arms crying. I made it. But when you got somebody who understands, even though she didn't understand, it's all about support. I tell people the most powerful thing in this world is love, healthy love. I'm telling y'all, I mean that. Because it is love that got me where I am, but also made me want more in my therapy. I had gotten kind of control of panic attacks. I know how to manage them. But I finally said, man, you will never get better until you finally deal with the impact of that trauma.
Yeah. And start talking about it.
Yeah, and then if you go 50-some years before you kind of do that, man, your mind is all twisted up with crazy thoughts and different stuff. So I try and get people.
And you start with like one thing's wrong.
And everything.
And then it's the next. It's like your ankle, then your knee, then your hip.
Right.
It
like
just
spirals.
Spiraling downhill.
Yeah, and I had a young man from Morehouse, a professor knew my story, and he, same thing happened to him, and except he was actually prosecuting the perpetrator, and he was about to go to court, and in another part of the country, and he called me for advice, and we talked, and he called me not long ago, and this had been a couple of years ago, And he just started crying, telling me, thank you, you don't know what you did for me. And I told him, I said, son, you're so much further ahead than me because you're dealing with this in your 20s. I was 60-ish before I got real. I just kept trying to power through. And that's the dangerous thing is all of us power through stuff. But you can't power through for decades and think it doesn't really impact you.
Yeah. It bleeds out.
Oh, it does.
Yeah.
It does.
So we're not very good at following their instructions.
Okay, let's go to their instructions, which is audience Q&A. So,
if you have any questions, there
yeah,
are
we got
apparently some
microphones.
microphones up here. If you,
and I'm not, neither one of us is shy.
I had to take my glasses off. I'm like, is that?
Yeah.
Am I reading that right?
Hi.
Hi.
So my name is Reverend Jody Susan. First of all, it is amazing to witness two grown men talk about their feelings. No, because men were quashed.
Yep.
So thank you.
You're welcome.
You're welcome.
Yeah, it's huge. My journey was a little different, and I was misdiagnosed in 1997. There were actually no diagnostics done. Having those panic attacks, by the way. During 20 years, I was put on 10 clinical trials, and they left me with 50 drugs in my body. It nearly killed me. 12 million Americans are misdiagnosed each year. I was born Jewish. Jesus saved me on my deathbed. That's why I became an ordained minister. Sorry, I'm shaking.
It's okay. Take your time.
Jesus told me to go see a neurologist. I said, why? I said, I supposedly have a mental health condition. And that day, of course, they asked me if I had a referral. I said, not the one that you're looking for, but yeah, I do. I started to look at mental health through the lens of neuroscience. And Adam, we spoke over the phone. And that bottle of water that you have has anywhere between 25 and 250,000 toxins in it. And I'm shaking here as I tell you this because I know it's going to rattle people to hear it. But we live in a world filled with neurotoxins, and the community, some of the community, I know not all the community, is not looking through this lens. And I reversed 54 chronic conditions, lost over 100 pounds, simply by going toxic-free. That's it. That's all. Well, and God. And so I'm wondering, when you're looking at mental health and mental health in the workplace, because I was having panic attacks every single day that I drove to work, so I get you completely. When are we going to, or have you thought about looking at the neuroscience, what's in our air, what's in our water, what's in our food? And because I teach about it through Georgia Addiction Counseling Association.
You know, I think, you want me to go first?
Go first.
I think, you know, what you're saying is very important because I'm a firm believer in toxic, you know, food, but I kind of chuckle to myself because I grew up drinking out of a water hose. You know, we weren't supposed, now we tell kids don't do it. You know, I kind of chuckle because I grew up without air conditioning. We hardly had anybody had heat strokes playing football. You know, they gave us salt tablets, which is one of the worst things they can do. So to me, I think our bodies and stuff change as we get aware. I'm a firm believer certain foods create, like sugar, you know, I need to watch sugar and all that. So I think you would be pleasantly surprised how many therapists really do talk about diet. You know, like I'm really big into nature. I think getting outside every day is important. I think that's why me being in construction was a blessing, because when I'm having a moment or feeling a certain way, I go to the job site. When I get out there in that noise and action and whatever I might have been feeling is gone because I'm outside. I'm in that noise. So I think you would be pleasantly surprised how much of us and therapists use that. But I'm at an age, I'll be very honest with you, I really don't worry too much about all that because it's all in me anyway then at 69. You know, I done drank out the water hose and everything. I still drop something on the floor. If you don't see me, I'm gonna pick it up and eat it. You know, so if you come to my house, yeah. So I'm just being real. You know, if it hit the floor, I'm still one of them 5-second rule people. You know, if we used to get it, pick it up, kiss it up to God, that's what we used to say, and then eat it. So I'm still kind of one of those folks, but I am very aware of what I put in my body.
Thank you.
Thank you.
And I'm very aware to stay in my own lane.
Right.
I'm the foggiest idea. I know I am not a clinician. I'm just a former CFO health plan exec that had this experience. So what's in water, not in water? All I know is that therapy is really good.
Right.
And
it's huge.
That's all I can tell you.
Yeah, that's huge. It's a huge step. Yeah. But what I will tell you, just to complete, is that I am reframing mental health for the world, backed by world leaders in neuroscience, so that people can have real health and not be consuming toxins.
Amazing.
Great.
Yeah, so thank you.
Thanks.
All right, we'll go back and forth. Go ahead.
How you doing, Mr. Moody? My
Good.
name is Dante Miller. Do you have any tips for superintendents on the job site if we see issues with some of these subcontractors that we can help with?
I tell you what, AGC, Associated General Contractors and stuff, has a lot of stuff on suicide prevention. And what Adam said earlier is something that I really practice. I am not a therapist. I'm not a professional. I just share my journey. So I'm going to tell you to go to AGC or ABC on suicide prevention. And they have all kind of information, so they'll tell you exactly what to do. But I will say this, if I see somebody that I think's having an issue, I just kind of say, how you doing? You all right? You know, you okay? You need to go home? You know, just talk to them with care.
I got you.
Yeah.
Thank you.
One of the other things you can do now, you know, there's a new, the new National Suicide and Crisis Hotline. It's now 988. But the thing is if you talk with them, they'll tell you that it's not just for folks in crisis. They want you to call before it becomes a crisis. And I was talking to them a few months ago, and they were saying that they want people to call 988, even if they're worried about their own or someone else's mental well-being and they don't know what to do about it. And they're like, we won't treat them, but if someone calls for advice, we will help them find where they should go. So anyone, it's like if you don't have an employee assistance program, you're like, I'm worried about myself, I'm worried about someone else, I don't know what the heck I do. Just call 988. It's funny, there's about a dozen magnets back there that have 988 on them.
Okay. Thank you.
Was that helpful?
Yes, sir.
Oh, one thing real quick. Now, you said I did 300 billion. It's 4 billion in my intro. I just wanted to clear that up. Because if I had done 300 billion, y'all be seeing me on Zoom doing this from an island. I just want to make that real clear. When you said 300 billion, I went, oh no, I wouldn't be sitting here. I'd have been sitting somewhere waving at y'all to how y'all doing. Did we answer you?
Yes, sir.
Good.
Hi, my name is Amanda Garcia-Williams. I'm a public health consultant, and I'm here with one of my friends. We're both first-year executive MBA students at Emory. And my question is related to what advice do you all have for us as we're going through our kind of business schooling of ways that we can support our classmates in thinking about their mental health, but also kind of a second piece is as we go into the business space and become leaders, what are things that we should keep in mind in supporting our staff, but also supporting ourselves?
You know, two things that come to mind is, you know, for me, it's just asking people how they're feeling. You know, it's actually when you for me, when I think about my times in business school, what I didn't do, we were just working. We never said, so how are you feeling? Is this hard? Are you tired? It's just having those conversations with each other makes all the difference in the world. And you're at a unique point in your life and all you and your classmates get to choose what sort of leader you want to be. Right? So like what they don't teach you in the MBA program is how to write a good job review, how to have a courageous conversation, that sort of stuff. And that's where being sensitive to folks' feelings and being aware of them will help you be a much better leader.
One of the things we have in our company, I have mental health days instead of sick days. Because there's nothing worse when people don't want to use a vacation day and then they got to lie and say they sick. So I don't have sick days. It's just mental health days. And I make it very clear when people come and I interview them and I hire them, said, look, there are going to be days you just need a mental health day. It's okay. And I think that's one of the biggest things we have to change in the workforce. And is getting people comfortable to say, I just need a moment. Because we all got stuff. We all got a story. And some days you just need a moment because maybe the kids are gone, the husband, wife, or whoever, or you just want to be home by yourself and quiet and go outside and just feel fresh. And I think that's what I would give. And I've got a rule. You're not my friend if you only call me, but you never ask how I'm doing. I'm always asking people how they're doing. And I started paying attention to the people who were calling me or wanting to, and I realized they never ask me how I'm doing, but boy, they sure want me to be all, how you doing? And then they want to spill their guts for hours. And it was just, so I started distancing myself from those kind of folks who only want to take energy, but they don't give anything back. So you got to pay attention to those things too.
That's right on.
Great. Thank you.
Hi, thank you so much for doing this. My name is Adarsh. Adam, I'm a CMC alum. That's how I got here. But yeah, I think it's really inspiring to see older, not to age you, but people come out and talk about this. Because
I'm a senior citizen. This dude's in his 50s, so one day you're going to go, man, that's young.
I'm just a little boy from Oregon, made it to the big time.
Yeah, because sorry, I am a different generation. I feel like it's more common to see my peers talk about mental health, and I think colleges and schools have gotten more open about it. But I think at my parents' generation, it's still regarded as like, this is hogwash, right? You only go to a mental health therapist if there's something wrong with you, right? If you have a mental disease, right? And I feel like I need advice on, I've been to therapy. How do I talk to older people in my family about doing this? And I've tried, and it's always so difficult. And yeah.
One thing I say that I tell people, especially when, if a spouse calls me about their spouse who went through what I went through, say, how do I get them to go to therapy? I say, you can't get them to go. They have to want to go. All you can do is give them information, and then they'll finally do it. But one thing I've learned, you can't make people go get help. You just have to give them knowledge. And eventually you'll be surprised how many people on the quiet will go.
And as you model the behavior, right?
Yep.
As you start talking, that's the whole opportunity for leaders, is you model the behavior of people, they see that it's
and that's why I share that I have two therapists, one's trauma and one's EMDR, because I want people to see, I'm going to tell you what I'm doing.
And some people, when you talk with folks, whether the mental health first aid program, they'll tell you that a lot of times when you approach somebody, they may not be ready for the conversation. But that doesn't mean that it was a failure. It just means that you've invested time in developing a relationship with someone to normalize the topic so that next time they may be more likely to have that conversation. So it's just, you just keep going. But to your point about young folk, I work around the country and I work with a lot of organizations. You're the one you're a part of, the Young Presidents Organization. And the Young Presidents Organization will have like 50-year-old folk and 25-year-old folk. These guys are like, wow, really? And these guys are like, yeah, no, duh. It's a generational thing. It's unbelievable. The next generation gets it. All want to like adopt him as your grandfather, or is it just me?
Man, you know what?
Please.
One thing I've learned when you age, there's something about you're free to share your story. You know, you get, man, I'm gonna be 70 years old in May. So
What do you care?
What you gonna do? You know, you can't make me go back to school. You know, something like that.
Speaking of going back to school, first of all, I want to just really thank the both of you. My name is Gina. I'm a mental health advocate, and I'm a filmmaker. After finding my biological father 22 years ago, thinking that he abandoned me, I found out he had schizophrenia and bipolar disorder. And not only did I find him, I became his guardian. And in 2017, he lost his battle with cancer, and I was there throughout the whole thing. So I thank God for allowing me to get that closure. What I saw was the different ways that people get treated. From his mental illness side, you know, he was ostracized. He went to the Boston School of Music and could play anything. And then there was the cancer side, which now we're all there for you. I also utilized that time to do a film, a documentary in honor of my father, to find answers, and I was blessed to have Mr. Moody be in the documentary. And the two of you are great examples of the fact that it doesn't discriminate, and I'm not talking race, I'm talking power.
Yep.
And so that's what I love about the fact that you utilized, I call it pain for purpose, and coming here today to be able to show that it has a face. And like the young lady just said, I decided to go back to school. I've been in the film industry for a long time. I was an executive at Turner Broadcasting, and I lost my job like so many others, including the young lady I just met today in the room. And I had to find my voice, and then my father gave that to me. And so, you know, it's not the thing that people bring the casserole dishes to. Oh, you're talking about mental health. Let's just go out there and bring you, you know, have a party. You know, and that's why it is so great what the Carter Center's doing with allowing us to start thinking about erasing the stigma. And you too, you know. But I decided to go back to school to get my MFA after producing a film for Tyler Perry. And I was stressing out. I was literally going in my car crying because it was so toxic. And not Mr. Perry, I'm not saying that. It's just the industry. And I was changing. And I had to figure out, how do I shift? What my question is, so I decided to go back to school, and in addition to getting my MFA at Georgia State 2027, go Panthers, I'm also teaching Production 1, and the very first day I walked into my class, I told my students, if you have any kind of mental health issues, I'm not a mental health professional, but I'm here to listen. So my question is, now that the two of you so wonderfully, and age, by the way, I'm in my late 50s, so it doesn't discriminate, and I don't let anybody tell me not to do anything. So the bottom line is, are the two of you gonna lock arms now? You got great books, you know, if I was gonna publish you, you know, be the PR person, pushing you out there. Going to these corporations, including where this young lady works, and talking to the CFOs and the CMOs and the CEOs about these kind of conversations and having quiet, even if it's just men's sessions, of how can we start to break down the barriers, because I wasn't afraid to tell my students. I had 3 students tell me they suffered from mental health issues. They spoke to me after class. I use 15 minutes before class is over so that they can talk to me about anything, and I guide them. GSU has a great program. Go talk to them, and if they don't help, 988 is good, but sometimes when you get to, as you know, that dark place, you don't even want to dial. So that's my question, and maybe it's nothing that you thought about today, but I think—
We already talked about it. We already said we're going to do this wherever people want us to come.
That's right.
Great.
Yeah, we're joined at the hip now.
Oh, yeah. That's the
Awesome.
greatest.
And he's not grandpa.
Right.
He's the coolest.
And let's connect the dot with the
Right.
parity work of the Carter Center, right?
Yep.
Because
We're here
you know,
because of them.
We're here because of them.
Yes.
Because parity is you cannot care about your employees' and colleagues' well-being and not support parity. Parity is access to care, and so the programming that's going to come up here over the course of the next year is going to be lovely.
Awesome. Thank you.
All right, it says last question. Do you want us to stick to the last question, or do you want the folks, how?
If they go really fast.
All right, he was next, and then, so we'll go fast.
They're fast.
Yeah,
It's
we'll go
just
fast.
We're long.
Go ahead.
We'll go fast. My name is David Afariat. I'm a member of EO, and I'm also a certified Bloom Growth coach working with CEOs and leadership teams. And I bring exercises to help a leadership team come together to create a psychological, zone of safety. But my question, first of all, I have to thank you so much for the knowledge that you've given us tonight. And for me, it's unlocked. My mother used to be a psychiatric nurse, and it's unlocked for me all the work that she used to do in mental health with health plans that we all know and that a lot of my clients, are actively changing. This is the time of year for enrollment. To me now, I used to use the word self-care to mean more about the body and yoga practices and health, but it really is for me, as a result of the night, this parity between mental health and bodily health to be what self-care is all about. My question is, what assessment, like 3-point assessment, could I take and would you recommend we all bring into the organizations where we're working and contributing to say, this is how things are they good enough, or can we get better? And maybe take the experiences from your current, the business you've built, right, and the one that you used to have, Adam, in the sense of how things were and how things are now. What would be like the magnifying glass where you say, this could be better? What assessment would you suggest?
How might I assess if my organization has a healthy mental health background and a healthy culture? Is Tahilia still here? Tahilia, are you still? There is an organization called One Mind at Work, and they are perfect for an EO. I work with EO folks all over the place, and this is the group that I send you to. In fact, I'm going out to California in a couple of months to work with them there. So what One Mind at Work has is an inexpensive program that's like a 25-question strategic plan that you run your leadership team through, that helps you ensure that you have created a culture that will create a healthy mental workforce. And their first question is, and I love this, say, as a leadership team, do you have a mental health strategy? And usually the answer is no. So One Mind at Work is a great place for EO sort of companies to go to.
Thank you.
You bet.
Yep. First of all, thank you very much, David, Adam. Good to see you again. I appreciate the conversation that both of you had about how this manifested while you were in work, and particularly because you were in positions to make a difference, own your own company, CFO, so forth. Could each of you share, in addition to the mental health days, a lot of what I believe people are going through at work is not about them, it's about the environment we put them in. They were actually in pretty decent shape until we sent them to work and overworked them, mistreated them, bullied them, did lots and lots of things that we had normalized across the environment that they've been in, and that's what triggered them. So can you talk about one thing apiece, after your reckoning and after your understanding about what was going on with you, something you said, look, we have to change this thing at work so it doesn't doesn't hurt other people. Yeah.
For me, it was just being aware. I had a situation not long ago. We were doing a big project, and my partner, joint venture partner, they were cranking some hours. I said, hey, man, this is unacceptable. I said, I don't work with my folks like that. I said, now, we have spurts where we got to grind it. I said, but if it's over a week or two, we got a problem. We need to get more people or something. So I'm just really aware of that. I'm real cautious. Sometimes I think I might be too aware. I'm like, man, am I pushing you hard enough? So I have to learn that balance of what's too much pressure, because there is a certain amount of pressure that's good for you. But what I really pay attention to is work hours. I don't believe in working a ton. Because I'm a firm believer, if you do what you're supposed to do and stay off the phone, the internet, and all that stuff, man, 8 hours a day, you can do a whole bunch of work. So it's all about being aware. And I think my empathy level, when I had my breakdown, went to a whole nother level. You know, and it's not about money. Because I'm a firm believer, if you're good at what you do, you'll make money. Because I know a bunch of people who've made a lot of money and they broke, and I know folks who haven't made a lot and they're wealthy. So it's what you do with what you got and how you want to spend your time. And as you age, you really start paying attention to protecting your peace. So I take that to work every day.
I learned I could be a nice guy and a leader at the same time. I always wanted just to be a nice guy, right? And that sometimes the leaders that we model can be not pleasant individuals. And so for me, you know, one of the biggest gifts to me was I was able to show up as a leader at work the way I show up with my friends at home. Yeah. They see me, there's no difference there.
Ma'am? Oh, you good? Yeah. Oh, so y'all done? All right, so we're done.
Thank you very much.
All right. Quick. For anybody who want to get your picture, get it real quick. All right, good.
Let's do it.
Don't go anywhere just yet. We got to land the plane. Give it up one more time for Adam and David. That was amazing. Seriously, thank you so much to the both of you for sharing these stories that, as we all just acknowledged here in the room tonight, are oftentimes really difficult to share, and encouraging us all to advocate for the well-being of our communities with vulnerability and authenticity. We're so grateful for that. They're a tough act to follow, and I recognize that we're a little over time, so I'm going to make this quick, but as promised, I'm back to talk about insurance again. But that's the thing, is it is so important. All of the things that they touched on tonight, creating that culture where we can talk about these difficult things, talk about our mental health with our colleagues, our friends, our neighbors, that comes about when we have the workplace policies in place so that they can exist that way. So, Adam talked about the ways in which mental health is being supported in the workplace. We're seeing so many more employers implementing a wide range of initiatives, including EAP programs, which is where Adam got connected, virtual counseling, supports for caregivers, flexible leave. But another significant way that employers can lead in this space is using their role as health insurance purchasers to drive change. Now, employers are pretty big customers of these health insurance companies. So, as a health insurance purchaser, you are entitled to know that the mental health coverage that you're paying for is actually being granted to your employees, allowing them to access that necessary care once they have these conversations and realize it's time for them to seek help. There's an opportunity to take an active role in holding insurers and third-party administrators as well accountable by ensuring a provider's compliance with mental health parity laws, like we had talked about earlier. Like we discussed, the Georgia Insurance Commissioner is responsible for enforcing that insurers are complying with parity laws. Oftentimes this results in fines when they're not compliant with the law. But frankly, for many insurers, it is cheaper for them to pay the fines than it is for them to cover mental health to begin with. It's that coverage that they're mandated to provide by state and federal law, and the coverage that they're being paid to provide. And this leaves people in need without access to care. But employers, again, are the largest customers of some of these health insurance plans and have the potential to have some real influence here. So how do you get started on this? First, make parity and access to behavioral health care a top priority for your business or organization. Consider it one of the ways in which your organization is a leader in making it a great place for people to thrive and succeed, along with other benefits and people business. Next, ensure your employees' health plans meet their needs and have transparent rules. Ask your employees, are they getting the care they need? And if so, is it affordable and accessible to them? Do they understand what benefits are available to them, or are they left dealing with convoluted insurance claims, processes, and denials when seeking that needed care? Finally, partner with your human resources staff to analyze your current health insurance benefits plans and express clear expectations to your insurance companies and third-party administrators. There are questions that you can ask your insurers to begin this conversation. This is just a few to get the conversation started. So we ask, does our health insurance plan cover mental health and substance use disorder care? Does our plan ensure parity? If fully insured, ask your health insurance company to demonstrate how they are complying with state parity law. They are required to prepare data anyway for our state regulators, so this is data that they should be able to supply to you when you ask for it. If you are a self-insured ERISA plan like we talked about earlier, you can access your claims data and analyze them using what's known as the self-compliance tool from the U.S. Department of Labor. Google it, you'll find it. It's a tool designed to assist group health plans and insurance issuers in evaluating compliance with the federal mental health parity law and its related requirements. And you may also ask, how robust is the list of in-network behavioral health providers? Because if you have coverage, but you can't seek a therapist for 6 to 8 months, or there's not one within a 2-hour drive of you, are they really available to you? How up to date is the provider directory? If there are not as many behavioral health providers available to employees as there are physical health providers, this can also become a parity concern. Don't worry if you don't get all this down, but you're interested. All of this information is in the one-pager that we had by the door. I've also got some with me in my seat over here, so come find me if you'd like to get it. And we'll be digging into these topics more at the Carter Center throughout 2026. And finally, continue to innovate and lead. You're here tonight because you understand that this is a priority and you're ready to learn more and take action. You know that behavioral health is critical to overall health and well-being. We've talked about how it's cost-effective to businesses to ensure employees have access to behavioral health care. So encourage your employees to seek help when they need it. If we continue, this was the theme of the night, if we continue talking about mental health as we would any other physical health condition, we normalize it and we encourage help-seeking behaviors. And I'd also like to mention that even if an employer does not offer health insurance, they can still educate employees who are utilizing an individual or a marketplace plan that they have the right to coverage under parity laws and assist them in navigating any processes associated with getting care. And again, ask your employees how they feel, what their experiences are accessing behavioral health care. This is a critical step as you tailor your approach to cultivate a mental health-friendly workplace. And finally, we invite you to partner with us here at the Carter Center. Tonight's event was the first of many events tailored toward mental health in the workplace. In 2026, we have a full year of programming, including an employer symposium, including several tailored roundtables based on topics that arose tonight. So if you're ready to dig deeper into some of these, I know parity gets overwhelming and jargony. We're going to break it down. We're going to make it accessible. We're going to help employers figure out exactly how to embed these practices and protocols into their workplace policies and culture. So scan the QR code to receive announcements about these events. Other resources, we have a forthcoming employer parity toolkit and return on investment report. There's a lot coming. We're so excited that we got to kick it off tonight here with you all. It's an honor to have you at the Carter Center. And Adam's book, Simple Mental Health, is still for sale tonight. If you haven't already, get yourself a copy. It's really great to see it in 3D after just seeing it in a PDF. So please get a copy. It's an incredible book. Come up to the stage, have it signed by the author himself, and keep in touch for all future workplace engagements with the Carter Center. Thank you all so much.